Hi everybody, Jenny here. I am a neurosomatic massage therapist and I have given a lot of home treatment options for my clients and patients to assist them in overcoming shoulder injuries and shoulder pain. I found that the shoulder can be treated effectively in the practice room, but it's a home therapy with balls, tennis ball, racket ball, lacrosse ball, and the foam roller that really creates a foundation and a constant healing for the shoulder. We're always moving our shoulders, we're always doing things. There's a lot of trigger points that are built up all through the teres major minor, the infraspinatus, the supraspinatus, the deltoids, and all the surrounding area. So get a foam roller, put it on the mat, and then lie on your side and place the foam roller right in your armpit. And just lie there. It'll look great, right? So, one of the things about the foam roller in this area is it can be pretty intense, particularly an old injury. So be real careful. Abs are nice and tight. Legs can go where you need them to go. Support the head in the hand, on the arm that's on the foam roller. And here you're going to go cross fiber friction. Back and forth, right in the armpit, right where all the attachments are from the humerus, from the arm to the shoulder blade. Back and forth. And rolling as the foam roller is stationary. You're doing all the work. Now come back to center, move it down a little bit to the lower part of your shoulder blade. So you are still on the blade, and I'll show that to you from the back or rear view in just a second. So I'm going to go back and forth on that foam roller again. You can come up and do a little bridge and go ahead and go up and down, superior to inferior, as well as anterior to posterior. Two ways that you can roll this. So now I'm going to turn over and show you on the back where I'd like you to go. So again, you're on your side, supporting the head with the hand, knees are bent, body is relaxed. You can bring that hand at the top up and hold it here. And see, I injured my left shoulder a long time ago putting a patio in, and it is tender. Right up underneath the armpit, you can roll the roller up and get right at the top of the shoulder blade, right here. You can even come back a little bit further and come forward. You can even lay and face your head down, chin on the foam roller. Come up a little bit, move it down, a little bit further down on the scapula. And if you find a spot that's real sore, relax the arm and hand. And take 2 or 3 big breaths until that releases. You should be able to feel that release. There's going to be some tough spots right here on the arm you're working. So right on that attachment, where all of the muscles attach from the arm into the scapula. So now there's some other options that you can use to get on top of your shoulder blade. So I'm going to move the foam roller out. I'm going to grab one of the balls. I'm going to start with a really soft ball, racket ball or tennis ball. I'm going to roll up and place one right underneath my scapula. And then I'm going to move my arm around in a circle as I find a trigger point on the shoulder blade. The shoulder blade has trigger points that keep reoccurring. And most people will say, I feel it right here. My shoulder's sore all through the cuff. And they'll say, I've got rotator cuff tears. And if you can get the ball and place it right here at the back of the posterior deltoid onto the infraspinatus and into the supraspinatus. You can even put it between the blade and the spine. And then you can do some internal and external rotation of the arm. You'll feel it up into your neck, all the way down into your back. So use the foam roller and use the ball. And you can do this in bed with a harder ball, a cross ball, or you can do this on the floor with a softer ball. Once again though, don't do it too long because you'll create pain. I want you to go into each trigger point until it releases, feeling the release. And hope this works for you because this is great. Thank you.